Hello, I'm Karen Lawrence, one of the implementation consultants here at MWI Animal Health, and I'm joined today by my colleague Olivia. In today's session, we are going to explore the practice efficiency tools available within Merlin. In today's fast-paced veterinary environment, making use of efficiency tools is becoming increasingly essential for practices. Merlin is packed full of features and functionality, and during this webinar I am going to highlight some of the key efficiency tools available to use which are often overlooked. By the end of today's session, you'll be equipped with the knowledge to utilise these features and improve overall efficiency within the practice by getting the most out of Merlin. The first area we are going to explore is the follow-up appointment feature, which is designed to encourage the practice team to book your patients in the diary for the next appointment whilst they are still in practice. To enable this feature, head to Administration, Settings and Follow-up. Here you have various options, but the one we recommend is Enabled and Selected. This option allows you to decline booking an appointment if necessary. Maybe a client is moving away from the area, or sadly when a patient has been put to sleep. There is an option here to allow a memo pop-up for the consulting vet to send a memo to reception if required. And the other option is to request a reason why the client declines their next appointment. If you do want to use this feature, you will need to create declined reasons in the appointment area within the libraries. If I now demonstrate how the feature works, I start with the consulting vet or nurse, saving the treatment, and they are then presented with a pop-up asking for details of the next recommended appointment. They are guided through a series of tabs, starting with making the next appointment, giving out any prescribed medication, taking payment, and finally ticking this box ends the appointment. Apart from ensuring no part of finalising a visit is missed, this feature assists in reducing the number of phone calls coming into practice, giving the team time for other essential tasks, and ensures you are continuing the relationship between the practice and your valuable customers. Initially, it may sound like there's a lot of steps involved, but once it becomes a routine, it will take seconds and completely removes the need for the consulting vet or nurse to have to nip out to reception to explain to the team when they next want to see the patient. Meaning whilst the reception team are managing their next steps, the consulting team can move straight on to their next patient.
So from experience of being in practice, there's no doubt the amount of time that would save throughout the day. I think it's also a much better experience overall, because if there was other times owners had received so much information during the consult that when they get to reception and they're asked, do you need to make any more bookings, the mind would go blank and the receptionist would have to go back, speak to the vet or the nurse, so everyone was super clear on the next steps.
Exactly. So taking a few seconds to get all of it added into the follow-up appointment is worth it for the consulting vet or nurse, the receptionist, and of course the client experience. Moving on, I now would like to talk about the activities icon. Activities is a really useful feature found on the top toolbar. It holds arrivals, clipper, and recently accessed. Activities can be left open whilst in Merlin, can be reduced in size if necessary, and does not affect anything else you may be doing in Merlin. Arrivals shows a quick view of any patients who have been marked as arrived in reception and saves the consulting vet or nurse having to access the diary or waiting lists to find out who is waiting. As mentioned, this means it can be popped open when in a patient record or when writing up clinical notes, for example. And the user can then continue with clinical notes without having to save where they are. Right-clicking on a patient allows you to add them with or without a note to a clipboard to be accessed at a later time. This feature is the clipper, and when the user selects the clipper record, the system will automatically load the selected client and patient in reception. Clipper is user specific, meaning that you will only see the patients you have added to the list. Another plus is that you can get rid of post-it notes or scribbling things down on your hand to remember to do them later. The Recently Accessed tab holds the details of the last few records you have recently viewed. This is so helpful if you get broken off and move away from that particular record. Again, this is user specific and you will only see records you have accessed.
I can already think of how beneficial all three of these features are. We all know it can get so hectic at reception with clients both on the phone and in front of you, where you'd scribble notes on any piece of paper you had around you, go back, look at it shortly after, and it makes no sense anymore. But having the clipper to tie a note to a client and patient is so helpful, as well as the fact that both the clipper and recently accessed are user specific is so important. So nothing is deleted by someone else and it's all very relevant to each user.
And there is a great area for general to-dos for the team by the actions list. But you're right, it is important there is the ability for user-specific ones. That quite nicely leads me on to the next area which we will take a look at, which are the day lists. The day lists are used to assist practices with managing tasks, processes, workflows and patient appointments within Merlin. Hospital operations, repeat prescriptions, full and waiting lists are there to provide comprehensive lists of daily appointments and prescription requests. These are the commonly used ones, but if you require any further guidance, please head to the Merlin manual. Let's look at a couple of examples, beginning with the waiting list. This provides a clear, precise list of the patients due into practice that day and the reason for their appointment. It avoids scrolling through the diary, which can be very busy and holds a lot of information. If you click on the drop-down option in any of the fields, you can select which columns you would like to see on your desktop. As this is a user profile option, Merlin will remember your preferred columns after you have logged out for the day. If you use surgeon names rather than room names, you also have the option to see only your appointments by selecting your name from the surgeon drop-down list. Repeat prescriptions is set up as a special surgeon on the diary and is a useful feature to allow the recording of requested repeat prescriptions. It is connected to the prescriptions icon on the top toolbar. The prescription requests on the diary will remain on the day they were added, changing colour as they are processed. The requests on the prescription list will remain open regardless of date until marked as dispensed, when they will move to a completed tab and will show blue until dispensed, when they will appear in green. This process avoids requests being missed on the diary. Tasks and workflow day lists are action, card, cremation, kennels, lab, radiology and ultrasound lists, and assist the practices with various tasks. When creating items within code entry, you have the option to send to before selecting the relevant list. This means that whenever that particular code is added to a patient's record, the consulting vet will be prompted to add the patient to the selected list, as you can see here. If I now show you the cremation list, you can see the process of marking the patient being sent off for cremation, ashes received back in practice, customer advised that the ashes have been returned, and finally the ashes have been collected. This provides an efficient way of identifying what stage the ashes are at. The card list works in a similar way, and once the patient is on the list, the practice can continue the process of creating a card and marking the card as being sent, selecting each option once completed. Both of these provide a digital journey, removing the need for paper-based entries that are at risk of getting lost or damaged. Not only that, having them set up to prompt users to send the patient to these day lists means there's no forgetting to add them on, as it's done at the time of adding treatment.
That would have been so useful in practice when often you'd have to check with other team members whether a sympathy card had been sent out or even whether a client had been notified that their pet sashes had been returned.
Yeah, absolutely. The next area to visit is Merlin's Useful Reminders feature, which is a method of producing regular notifications via SMS or email. This functionality allows you to send these reminders either manually or as an automatic schedule, and are created via a combination of reminder reasons and adapting the reminder area within code entry. Sending your reminders via the automatic reminder schedule allows Merlin to do all the hard work whilst you concentrate on other tasks. It also gives the clients the reassurance that they can rely on the practice reminders to keep their pets up to date with preventative health care. Please be aware that your reminders can be controlled by the GDPR data consent functionality, in that if you set them up specifically as vaccinations or flea reminders, for example, rather than as a contractual communication, then the reminders will only be sent if the data consent is up to date in your client's records. To create reminder reasons, head to your reminders library via Administration, Reminders and Reminder Types. Here you can see I have added a Librela injection reminder. Next, you head to Code Entry and search for the Librela injection code. Select the code and click on Edit and choose the Reminders tab. In here, we mark the entry as Reminder Required, select the reminder reason, and will then set the reminder for 4 weeks. Any owners of dogs who have had this treatment in practice will automatically receive a reminder in 4 weeks' time.
So if a client doesn't action that reminder, i.e. they don't book their pet in for their appointment, do they receive another reminder?
It is totally up to the individual practice how many reminder schedules are set up, but remember, it is also possible to create overdue reminders, which does help with capturing those patients who have not been in for required treatment. Compliance reminders are reminders attached to your antiparasitic products within code entry. These reminders are triggered when flea or worm products are dispensed and are sent in a timely reminder each month to remind your clients to apply the treatment and also to order more product if required. If the client doesn't purchase more product, then the reminders will stop. To show you in code entry, the compliance reminder is here, the second option, and is completed as so. The next area we'll have a look at is your healthcare plan renewals. Keeping on top of your healthcare plan renewals can feel like a never-ending task, especially as they're so popular with clients, but Merlin has a quick and easy way to assist you. Healthcare plans renewals are built into the healthcare area of Merlin and are there to restart the plans once 12 months is complete. There is a manual process, but as I mentioned, it's very quick to do. Completing this task refreshes the plan, ensuring that your patients receive a full allowance of products and services offered on their plan at the beginning of a new 12-month term. To run this task, we navigate to Administration, then Healthcare, and select Renewals. Now using the filters, add the requirements in each of the drop-downs. In this example, I have selected plans due in the next 12 months. I'm going to include overdue plans just in case there is an issue with any. The status I have chosen is not auto, which means these are plans which haven't been set to renew previously. Choose your site, and then we select a plan one at a time for the process to work correctly. You are now presented with a list of current patients on the selected plan. Click on Select All, which will put a tick to the left of all listed plans. Now choose Assign Action. You should see ticks in Auto Action this plan, Auto Renew. If a plan isn't detailed here, then choose from the drop-down list. And then there should be a tick in the write-off debt balance. This will start the plan off afresh from the start of the next 12 months with full allowance. Finally select OK, and all plans on the list will now show as pending. They will remain as such until their renewal date is reached. It's good to note that it doesn't matter at what stage of the 12 months you set the renewal. because should you have to cancel a plan, that plan will be removed off the list when the end plan is actioned, therefore creating a seamless, time-saving transition from one year to the next. It is also worth mentioning that it is possible to manage healthcare plan allowances when setting up your plans, which avoids over-discounting. Let us look at editing a flea treatment allowance, which splits over the 12-month term of the plan. Once in your healthcare area, select a plan and click Edit. In here, we choose the quarterly flea option and again Edit. And now we set how many products, here 3, can be dispensed within a certain length of time. We can then continue adding other options for the remainder of the 12-month term. This, as mentioned earlier, avoids over-discounting and negates the need to manually work out the patient's allowance.
What happens if a client is going on holiday and wishes to collect their flea treatment early?
That's a really good question. The practice could overlap the allowance period, such as 3 per pets in the first 0 to 90 days, as we have just set up. And then for the next allocation, select 80 to 130 days, which allows enough available product to suit the customer's schedule. Our next area to have a look at is the report wizard, which is accessed via Utilities and Reports. Here you can see 2 options. The first option is Standard Reports, which holds the preset report templates and requires the user to choose their own filters before saving as a PDF or CSV file. It might be worth mentioning that there are 2 new options available, where the user can select the recently used reports and also select their favourites to use at a later date. Report Wizard is the second option, and this area enables the user to build and save their own reports for future use. Using the top headings Client, Patient, Treatment and/or Reminder, you then select from the drop-down options within the 3 columns below. Let's look at a couple of examples. The first one could be to identify which patients have been prescribed on a certain injection, for example, caninsulin. This saves the practice the manual effort of looking back through invoices or drug usage records to identify a certain drug and provides a concise list of the treated patients. So for this, we would choose Client, Patient and Treatment and select the appropriate fields. Another one could be sending a text or email out to clients inviting them to bring their older pets in for a senior health check. For this, you would select Client and Patient from the top row and now select the site, the species and the age range. If you wish to use this criteria again, simply select Save at the top and name the report and select List. To use this criteria in future, simply select Load and choose the saved report. At this point, simply change the dates. Now we select List, and this will produce your records which match the selected filters. From the list, you have the option to send emails, letters or texts to the recipients on the list or export to a CSV. Remember, when exporting a list, you have the choice whether to include PII, which is personally identifiable information. To include PII, you unselect this box and export to CSV. Report Wizard is a fabulous tool for targeted marketing, as in our example of identifying dogs over a certain age. Sending invitations such as this is going to increase footfall into the practice and whilst doing so increase sales, as vets may identify health issues which the owners may be unaware of. Keeping in touch with your customers helps to maintain relationships, and by sending invitations out in bulk saves time for the practice. That brings us to the end of today's webinar. I hope you have found it useful and can take away some new ideas to try and practice. Please remember the Merlin manual for step-by-step guidelines through the usage of Merlin. And if you do require any more details on anything discussed today, you can email us on contact@mwiah.co.uk. Thank you.